Hello, I'm Kim Warren. Like those who run many of the world's great cities, the Greater London Authority is concerned to understand and improve the quality of life for those who live and work in the UK's capital. And they've been tracking quality of life indicators for a number of years now. However, there's a feeling that in order to develop policy that can improve and sustain a high quality of life in the capital, there's a need to understand better the way in which all the features of quality of life actually interact with each other and how policy affects that. So this presentation is a work in progress explanation of how we might go about this. Now we are starting from a pretty good point. There's a wide range of pretty appropriate quality of life indicators that the GLA has been tracking for a number of years now. There's good information on those things and some trend information about them as well. So we're not just looking at snapshots. They've also been doing some work which they've commissioned from Denny Gray at CAG Consultants to understand some of the interdependencies between those indicators. So what is it we're trying to add to what we already know? Well, the opportunity is if we can map the interdependencies amongst those indicators, then we may get better insight about what's going on and be able to make better decisions and develop better policy. And that, in the process, that will clarify what the key predictors of quality of life in London actually are. And we will be able to tie in links to the policy levers, the things that the authority and others actually decide to do, and the costs of those things as well, and the financial benefits from making better decisions. We can actually go a little further still, though. Optionally, we can build a working model of how these aspects of London actually work to help improve policy still further, and possibly even open up the model to the public as a game that you can play, where you can take the role of somebody trying to make these decisions for London and see whether you can improve things still further. So a typical framework for evaluating and monitoring policy impacts is shown on this diagram. This is actually taken from a pretty standard framework in government. This one happens to be what's used by the Department for International Development, but it applies to all kinds of policy areas. The basic idea is that you put human and financial and material resources in at the left, and you have impacts coming out at the right. So, for example, if you were to spend public money and deploy some land, then you could develop sports facilities. And the outputs from that is that sports facilities actually become available. The outcome you want is more people to participate in sport, and you hope that the long run impact of that would be improved health. Another example, if you could persuade business to put more money and executive time into training, then you'd increase skill levels, then you'd get more and better employment, and then you'd be able to reduce poverty. The difficulties with this, though, are that you can't be certain of the links from the things on the left-hand side to the outcomes and impacts on the right, because the cause-effect relationships are really genuinely quite complicated. And that is because of the system nature of the situation you're trying to deal with. So the complicating factor is that between those inputs, activities, and outputs on the left and the things on the right, you've got this thing called the London system, which includes people and organisations and the way they behave. So if you put money and construction into developing sports facilities, you might get people changing their behaviour and participating more in sport, but facilities may not be the main constraint. So when it comes to tracking outcomes, there will be multiple explanations for why there's more participation. And that makes it quite difficult to figure out whether you are going to have that impact on health that you wanted. A further complicating factor is that there's feedback in the system. So if, for example, you did get more sport participation, then other people would see that, and those people too would take up sport. That's a reinforcing feedback where the thing will accelerate its own growth. On the other hand, the more sport participation you have, the more costly it is to sustain facilities. The standard of those facilities might fall, and that might lead to a reduction in sport participation. So that's a balancing feedback that would actually stifle your attempts to make progress on that particular issue. And that would slow down the benefits for health improvements that you want. So this system has got a number of complicating factors that are common to all such systems. First of all, critical factors accumulate over very long periods. There are very big delays from actions you take to the results that emerge from that, and consequences can continue for many years. If you've built those sports facilities over the last 5 years, then you're stuck with having to finance those and maintain those for years and decades out into the future. There's interdependence in the system. Multiple choices need to be right on multiple issues. If you want to increase sport participation, then there's a whole host of things that might need to happen, not just building sports facilities. Then you've got those feedback mechanisms that exist that can accelerate change, both good changes and bad changes, or stall or backfire improvements that you want to make. And lastly, and this is a really challenging issue to deal with, there are thresholds in these systems where things that actually will do something useful and something good don't seem to have any impact until a tipping point is reached. On the other hand, things can actually be getting a little bit worse all the time, though you don't really notice. Then all of a sudden you reach a tipping point, a threshold is crossed, and let's say crime rates increase, or the reliability of public transport suddenly collapses because something has happened over quite a sustained period and got you to a tipping point where it goes wrong. Now, it turns out that a method called system dynamics, which has been around since the 1950s, is precisely designed to deal explicitly and quantitatively with all of these mechanisms. That's what it was for. That's the principle underlying what we're going to talk about in the rest of this presentation. So the initial mapping of this quality of life system, it's quite a big and complicated system. There are something like 33 indicators being covered here. So we need to kind of break it down into major sectors. So we've got health, employment and poverty issues, education and skills, housing and the quality of housing. There's the business sector of the city and the activities that businesses do. Transport clearly is a major issue in any city. We're concerned with environmental issues like waste, air quality and carbon emissions. And then there's the very soft and subtle issue of social capital. So a place to start is to figure out the broad overview of this system. So up at the right-hand side, we've got the health of the London population. And of course, there'd be many indicators of what that health level actually is. But we would like that health level to increase progressively over time out into the future. And that's what that chart in the middle says. We've got a few years of slow improvements to health, and then in later years, health is improving at a faster rate. And the little thing on the left is a pumping more health into the stock on the right. So what we want to know is what affects the rate at which health changes. Now, of course, there are many factors that affect the changes in people's health, but one of those is income. So if we get an increase in incomes over a number of years, then we might expect that would contribute to improving health levels. Where does income increase from? Well, that increases if people have higher levels of education and skills. So if we can build the skill level of the working population in London, then we might expect that on average people's incomes would rise. Now, if you've got higher levels of education and skills, then we'd expect employment levels to improve, and that too would assist in boosting incomes in the city. And that will be assisted if business is more successful, more businesses get started, more businesses survive, and the number of businesses in the capital increases. Now, business, housing and transport all have environmental impacts, and we can expect with a growing city, as London is, that there'll be more housing, there may be more transport activity taking place. And if there's more business growing, they would expect those environmental impacts to increase. And if those are negative, such as deterioration in air quality, then that might have a negative impact on the health levels of people in the city. But of course, growth in the business sector implies that the state of the London economy, if you like, the GDP of London, will improve, and that too will help improve the income levels of people living in the city. Employment and a host of other factors affect what's known as social capital. the degree of strength of social networks, family networks, and so on. And that, plus all these other things, health, income, and so on, improve life expectancy, improve people's happiness and satisfaction with living in the city, and we have other desirable outcomes, which is more people participating in voting in elections and volunteering to help in the community. So this is just a very high-level summary. And of course, we've got policy levers. We decide on spending money and we take other initiatives to try to improve these things. And improving things basically means pumping things in to the left-hand side of those stocks. So we might extend the public transport network, or we might invest in social housing, or we might subsidise the startup of new businesses, for example. We might take various initiatives to improve health levels. We might have policy things we do to try to improve social capital, like support for social services. Clearly, there's a big issue on training and education and skills to enhance employment. So the colour key here is that the red things they either are quality of life indicators themselves in the GLA's reports, or there are quality of life items within those. The darker purple items are important issues on which we don't have direct information, and the bright pink items are the policy levers that we've got. Now, of course, this is a highly abstract, high-level view of the situation, and there's a whole load of other factors that are involved. We can't take them all into account, but we need to recognise that they are there. Now, of course, I'm showing a very optimistic future indeed in these diagrams, and clearly things are not always improving. Sometimes they're getting worse in spite of our best efforts. So this, if you like, is a kind of aspiration as how we would like things to develop in the future. So what are these quality of life indicators? Now, the Greater London Authority has this issue looked after by a commission called the London Sustainable Development Commission, and you saw a screenshot of their 2012 report on the opening screen of this presentation. But that report includes these 33 indicators broken down into environmental issues, social issues, and economic issues. And these cluster into the sectors that I described a few moments ago. So the provision of childcare, the level of crime, employment rates, child poverty are examples that are in domain A, the employment, poverty and health domain of the situation. Clearly, education, primary school, secondary school and skills are in the education and skills sector. We've got housing related issues. The economic sector of the indicators covers most of the business and economy factors like gross value added by business and the degree of innovation. Transport factors feature in the environmental sector. There's a particular issue concerning carbon efficiency, which actually pops up in 3 of the other sectors. And of course, the environment sector covers most of those items remaining in the left-hand column. And finally, at the bottom of the social category are the issues that we'll find in the social capital part of the model. So here are the indicators that have been tracked, and the LSDC has already attempted to figure out from this quite extensive list what items are drivers of quality of life and what are kind of outcomes. And that's the work that Denny Gray at CAG Consultants has done, and identified these highlighted items as being key predictors of quality of life, and this range of factors being key outcomes of quality of life. So what we're trying to do is dig in a little deeper and figure out what the mechanisms are that connect those drivers to those outcomes. So let's go into the health, employment and poverty sector first of all. Now, what we want is we want better health so that we can expect life expectancy to rise. Once again, the red says this is one of those 33 quality of life indicators. Physical activity will improve health, and there are plenty of other factors as well. Income levels, as we said, will improve health, but out of income levels we can directly extract 2 other indicators to do with child poverty and fuel poverty. Income levels rise if employment rates increase, and there are inputs to that from education and skills from the business sector. Business performance clearly helps improve income levels. If businesses are doing better, then they can pay people more. And provision of childcare makes it possible for people to become employed who would otherwise find that difficult. And on the left-hand side there, you've got one of the pink policy issues, which is the provision of childcare capacity. On education and skills, the quality of life indicators are tracking numbers in primary education and secondary education, and children move through those two levels of the educational system. Some of those school leavers leave and go straight into jobs, so that connects into the employment sector of the model. It's not just the number of jobs, there's also an important issue of what the quality of those jobs are. Are they basic labouring jobs, or are they highly skilled jobs? Other youngsters, though, of course, go on to college or they take up apprenticeships. So we've got the tertiary education and training sector to think about. Now, that actually isn't part of the quality of life indicators that are currently being tracked, but we can see that it might be useful to include indicators on tertiary education and training. And we do all this because we want to raise the skill levels of the people who work in London. So there are various policy things that are done in order to try to increase the quality of the education and training that's provided. If that happens, you get higher skill levels, and that means you don't only get more jobs, it also means you get better quality jobs and hence better incomes for people. Now, this is also affected by people retiring from the system. When people retire at the end of their working lives, they take whatever skills they have with them. We also have issues of migration. London has seen quite substantial rates of migration, people coming in and bringing skills into the capital, and other people leaving and going elsewhere and taking those skills with them. And all of this, of course, enhances jobs and, in due course, improves business performance in another sector of the model. When it comes to housing, we start by tracking the sheer number of dwellings, how many housing units actually are there, how many houses and flats. And that is increased if people build more houses, but of course very often older and unsuitable housing is demolished, and that reduces the number of dwellings available. Now, we're showing here the number of dwellings as a single stock, but clearly there are different categories of housing that are available in London or any other city. And an important distinction is between housing which is privately constructed, privately owned, privately rented, and social housing which is either bought and paid for by the public sector or by housing associations and other such bodies. That affects house prices and rentals, because there's the balance between the number of people who need housing and the number of dwellings available, and that shows up in the quality of life indicators in this indicator called housing affordability. So the affordability of housing is how do house prices and rentals compare with income levels. But when you build new houses, you don't just increase the number, you hope that you build better houses than those that are being demolished. So the building of new houses, we hope, raises the overall quality of housing in the capital, but we can also have policy levers as well to help improve the quality of existing housing stock. And that shows up in this indicator called decent housing, which is in the list of 33 items. A further issue arising from housing, though, is the impact on the environment. When we burn fuel to heat our houses, or we consume electricity to power the lights in our houses, then we're generating carbon dioxide emissions, and that has an impact on the environment. Carbon dioxide emissions are one of the indicators being tracked. So when we develop new houses, we hope that those houses will be more energy efficient than those that are being demolished, and we can also put efforts in on the left-hand side to improve the energy efficiency of the houses that already exist. And fuel is expensive, so this also has impacts on poverty. Now, I should just pause briefly here and emphasise a little point in the note at the bottom left. This is a big and complicated system we're dealing with here, and in order to make it possible at all to follow what's going on, I've had to simplify significantly the causal relationships in these diagrams. And those who are deeply familiar with system dynamics will have spotted that some of what I've done here isn't strictly conforming with the principles of system dynamics, but clearly when we do the work in detail, we will make sure that it does conform with those standards. Moving on to business and the economy, there is a number of businesses in the capital. New ventures get started and some fraction of those businesses fail each year. And businesses generate GDP, gross value added, one of the indicators in the set. And business survival, the number of failures relative to the number of businesses, is another of those indicators. Business tends to survive and start successfully if business performance itself is quite good, and that happens if businesses are effective at what they do, and that's the contribution that comes from efforts at encouraging businesses to be more innovative and to employ the education skills coming out of the education sector. So business innovation is another of those 33 indicators. And when you start those businesses, that creates a number of new jobs. And if businesses fail, then the jobs that were with those businesses go away as well. So that's where the link to the whole of the employment sector arises. Of course, this picture only captures the number of organisations in the commercial business sector of the economy and the employment of jobs that are associated with businesses. There's a whole mirror image of this picture which deals with the number of organisations in the public sector and all of the very important public sector jobs and employment and income that arises from that sector of the economy as well. Businesses too use energy. So just as we had with the housing sector, we've got businesses starting up add to the energy use and the CO2 emissions coming from the business sector in London, and businesses that fail and take away their energy use and they take away their contribution to carbon emissions. But of course, we can also encourage by policy means efforts to improve the energy efficiency of our businesses. Transport's a big contributor clearly to emissions and to other aspects of quality of life. And there is a number of vehicles that use the streets of London. So that number of vehicles is increased when private individuals or businesses or public services buy new vehicles, and older vehicles get scrapped on the right-hand side. There are policy levers here, clearly, that the GLA could choose to spend more on buying more new vehicles. They can impose congestion charges or parking charges to discourage the use of private vehicles, all that kind of thing. And fuel prices are a very important exogenous factor. If fuel prices go up, typically people tend to try to buy more fuel efficient vehicles than the ones that they're selling. Those changes in the vehicle fleets change the efficiency of those fleets over a number of years. And generally speaking, vehicles are getting much more fuel efficient than they used to be historically, so we can expect that that efficiency level will continue to rise as the fleet gets replaced. This particular piece of the model is replicated between public transport, private cars and motorcycles, and business transport vehicles. Now, it's not just how many vehicles there are that matter, it's how much they're used. So the actual traffic volumes, one of these quality of life indicators, is determined by how many vehicles there are multiplied by the usage rate. And the usage rate reflects the choices people make about how they travel to school, how they travel to work. And once again, we've got policy influences coming in from the right-hand side. Travel to school is one of the quality of life indicators that's tracked, and the mode by which people travel to work could be another such indicator. All of that, the traffic volumes and the vehicle efficiency, determine carbon emissions and the creation of other airborne pollutants, which has an impact in the environment sector. Here is the environment sector, and now we've got the CO2 emissions coming from the vehicles that people are using, the businesses that exist in the capital, and the housing and the quality of housing in the capital. And all of that contributes to air pollution which is another of our health-based indicators. A further thing that households and businesses do, though, is they generate waste. So there is a rate at which businesses generate waste and a rate at which households generate waste, and the total waste output in London reflects all of that activity from both of those sectors. And one of the quality of life indicators that is tracked is the degree to which households recycle their waste rather than simply throw it out for landfill. And other indicators could look at the degree to which people reduce their use of items that would otherwise be scrapped, or reuse things rather than throw them away. A further indicator that's being tracked is the rate at which water is being used in the capital, and effectively the rate of water use is simply a copy of that rate of waste generation. So each household and each business uses water at some rate, and if you add all that up, that's the total water use in the capital. Lastly, we've got the ecological footprint of the population of London, and we've got indicators to do with access to nature, and bird populations are being tracked. So if the city were able to increase the amount of green space that was available, then you would expect bird populations to improve, access to nature to increase, and the ecological footprint to go down. But the ecological footprint is also determined by carbon emissions and waste generation and water use. Lastly, we come to this very squishy area of social capital, and this generally reflects things like family and social networks. So how well connected are you to your own family and to networks through your work or through your social contacts or through communities of which you're a part. And there are clearly many factors here, but some of those that might be involved might reflect employment rates and the affordability of housing. If people can afford to live near their family and their communities, then we might expect the strength of those networks to improve. And one of the consequences that we would hope for from strengthening family and social networks is a reduction in the proportion of people who engage in criminal activity, and hopefully a reduction in the rate of crime, which is another of the quality of life indicators. Policing, of course, will also have an impact on this. There's much more to be said about crime than this, but this is a highly summarised view of the kinds of influences that are involved here. There's some evidence that stronger family and social networks and higher income levels tend to be associated with more people volunteering, another quality of life indicator. That's people helping out in their local community, looking after the local environment, and doing other voluntary activities of that kind. And all of these things will contribute to improvements in health, to life expectancy, and to the happiness and satisfaction indicators that the quality of life surveys are tracking. And one of the things we might like to see is higher participation in the democratic processes through greater voting at elections. So that too is an indicator being tracked. Exactly what causes voting activity to be higher or lower is another of these rather complicated issues. So that wraps up the social capital, and that's the last of the domain we've looked at. Here are the conclusions we've reached so far. Quality of life outcomes arise from the way in which the London system actually behaves, and that system includes lots of interdependencies. There's a lot of really good information here, but there are additional items to be added to that: training and tertiary education, policing. We've said nothing at all about social care, and we might need to think about migration. This mapping I've shown in this presentation so far is highly provisional and incomplete, and more is to be done on this, and we need to establish more strongly the links to the policy choices that are available to politicians and others who are involved in the management of the city, and we need to add in the financial inputs that are made, the expenditures that are put in to make things better, and to the financial consequences that arise from this, the expenditures that have to be made as a result of the quality of life not being as good as it could be, for example. Now, I've said that we can go on and actually model this, so this diagram shows just a section of a very simple demonstration model of some of the items that might be involved in this quality of life situation. The data is purely illustrative. There are no real numbers in this, but it does show the way in which some of these relationships actually work out. And if you go to the link that's shown here, sdl.re/city quality of life demo, then you can actually play with this model and make some decisions about how much to spend on training or how much to spend on providing additional sports facilities, for example. In this case, the scenario being shown is that spending more on training raises skill levels faster than skills are lost. So the skill level in the box in the middle there starts to rise halfway through the period. The initially rising poverty rate, because skill levels are actually declining in the scenario we start with, actually starts to fall rather than rise. But then falling poverty actually slows down the rate at which health declines. Up at the top, we've got falling pollution levels in the air quality in London, and that means that health does not deteriorate as quickly as it would otherwise have done if air quality remained poor. And on the left, we've got more people taking exercise, which we believe will contribute to increasing health and rising life expectancy. Of course, as I've said, there are many, many other factors affecting health levels than this. So this is purely a demonstration of some of those items that might be involved. So how might we take this forward? Well, a first step is to validate this model. Consult with the people who know about those many sectors of the situation and check with them that we've got the causality right. Have a look at what the data says about those things and then add in the links to policy and financials. And that alone should help improve our understanding of the key predictors of quality of life and inform policy and financial choices that are made. So even that might well result in financial savings and improved impacts on quality of life. From there, we can go on and build working models of this. That allows you to test policy options and further improve financial savings and achieve better management of the situation into the future. Just a general point here. Yeah, we now have the capability to test all significant policies and decisions in all fields with this kind of simulation. It allows you to see what impact choices and decisions and expenditures have if the real world works the way that the model suggests. Finally, as I said at the beginning, it is possible, if we've got one of these working models, to develop a realistic game where people who are not experts can actually see systems like this operating and get in and make choices for themselves and engage and become informed about the issue themselves. So thank you for listening to this presentation. There's more on strategy dynamics generally at strategydynamics.com and on the software we use at systea.com. I should just mention that most of that work is oriented to the corporate sector, whereas this, of course, is a kind of public sector topic. As I say, you can go to that illustrative model and play with it with a few of the levers in quality of life for yourself. And you can see an example of a policy game based on the US healthcare system as it happens if you go to simudyne.com.